These are the scenes that have become all too common across Latin America. Frontline doctors and nurses battling to keep COVID-19 patients alive. But there are thousands of others, often labouring day after day behind the scenes or in remote communities, part of the same fight against the same unforgiving enemy. ANSELMO TUNUBALA is a nurse working in Cuenca in the southwest of Colombia to reach and vaccinate elderly members of the MISAK indigenous community.
I go from house to house raising awareness about vaccination against the virus, because elderly people always have low defenses and it's to protect them from the disease that we're facing.
The pandemic has hit indigenous people across Latin America disproportionately hard, since they often live in remote communities with limited access to adequate health facilities. They rely on medics like ANSELMO, but he's often met with distrust and suspicion. Some he can persuade to accept the vaccine.
We didn't think of getting it because we used to cure ourselves of anything with plants. But as this is a worldwide problem, there's no other solution. Whoever wants to can get the vaccine. It's not obligatory, but you will feel safer getting it.
Others prove to be more resistant. Carlos TUNUBALA shares ANSELMO's last name, but not his belief in modern medicine.
My family and I will not get vaccinated because that is my belief, because the pastor has taught us that it is not necessary. By trusting in God, we will get through this. We will overcome everything that comes our way, including disease.
Colombia has recently seen an increase in COVID-19 deaths, bringing their total up to more than 70,000. There's an even worse picture in Brazil, with more than 14 million infections and 386,000 deaths. Ambulance driver Carlos APARECIDO sees it every day.
We once brought in a couple, husband and wife. They were admitted, they were very unwell. They got worse, were incubated, and they both died 10 minutes apart from each other. And on the way to hospital, even though they were in a bad way, they were chatting. That's something that stuck with me because it was a couple, imagine. It wasn't easy.
The 52-year-old has been an ambulance driver for 12 years, but says he's never seen anything like this. Never expected to have to deal with such relentless misery.
We hope that today will be a better day. Let's hope it's not as bad as other days when we see people desperate, crying. After all, it gets to us because we're right there, witnessing people suffering. It's not easy for anyone.
Brazil is suffering about 4,000 deaths a day. And with the vaccination program being rolled out more slowly than most people would like, there's no end in sight. No respite for thousands of workers like Carlos and ANSELMO. Daniel Schweimler, Jazeera, Buenos Aires.